अस्सलाम वालेकुम स्टूडेंट्स, उम्मीद है कि आप सब लोग खैरियत से होंगे. You have already started with a new topic, that is the lower limb, and you have already gone through some important topics of the lower limb. Today we will discuss the medial and the posterior compartment of thigh. The purpose of this lecture is that by the end of the lecture you should be knowing about the cutaneous innervation, the fascia covering the compartment, the muscles, the blood vessels, the nerves, and the clinicals which are related to the compartment. लोअर लिम्ब के कंपार्टमेंट्स को भी हम उसी तरह से डिस्कस करेंगे जिस तरह से हमने अपर लिम्ब के कंपार्टमेंट्स डिस्कस किए थे. दैट इज़ स्टार्टिंग फ्रॉम द स्किन में उसकी कुटेनियस इनर्वेशन, द फेशिया के अंदर जो सुपरफिशियल लिम्फेटिक्स हैं, जो वेन्स हैं, और फिर जो उसके मसल्स अटैच्ड हैं, मसल्स को ब्लड सप्लाई जो हो रहा है, जो उसकी इनर्वेशंस एंड ऑल दैट थिंग्स. नाउ जस्ट टू रिवाइज, हमने जो हमारी थाई है उसको हमने 3 कंपार्टमेंट्स में डिवाइड किया है. दैट इज़ द इंटीरियर कंपार्टमेंट, वी हैव द पोस्टीरियर कंपार्टमेंट एंड वी हैव द मीडियल कंपार्टमेंट, एंड दीज कंपार्टमेंट दे आर सेपरेटेड बाय 3 इंटरमस्कुलर सेप्टा. The medial intermuscular septum, which is separating the anterior from the medial compartment. Then we have the lateral intermuscular septum separating the anterior from the posterior compartment, and then a vaguely defined posterior intermuscular septum separating the posterior from the medial compartment. अच्छा, लोअर लिम्ब की एज अ होल आप कुटेनियस इनर्वेशन जो है ऑलरेडी डिस्कस कर चुके हैं. जस्ट टू रिवाइज कि जो मीडियल कंपार्टमेंट है, इट इज़ इनर्वेटेड बाय द मीडियल कुटेनियस नर्व ऑफ थाई, विच इज़ बेसिकली अ ब्रांच ऑफ द फेमरल नर्व सप्लाइंग द कुटेनियस इनर्वेशन टू द मीडियल एंड सम पार्ट ऑफ द एंटीरियर कंपार्टमेंट ऑफ द थाई. इसके साथ ही हमारे पास है ऑब्चुरेटर नर्व, विच इज़ अ ब्रांच ऑफ द लंबर प्लेक्सिस, बेसिकली कमिंग फ्रॉम द एंटीरियर डिवीजन ऑफ द ऑब्चुरेटर नर्व. दैट इज़ द कुटेनियस ब्रांच ऑफ द ऑब्चुरेटर नर्व. Now, if you talk about the contents of the medial compartment, we have important muscles which are the adductor magnus, adductor longus, adductor brevis, gracilis, and obturator externus. Now, this compartment, that is the medial compartment of the thigh, is also known as the adductor compartment, and the arteries which we will discuss in this compartment, we have the profunda femoris and the obturator arteries, and the obturator nerve is basically the nerve of the medial compartment of the thigh. Now we will discuss the muscles separately. The adductor compartment में सबसे जो largest powerful muscle है, that is the adductor magnus, which is the most posteriorly placed muscle in the adductor group. It is basically a triangular shaped muscle है, और इसको हम composite muscle या hybrid muscle कहते हैं, because इसकी this adductor magnus is composed of 2 parts. एक इसका adductor part होता है, इसका hamstring part होता है, और दोनों की जो दोनों parts की जो attachment है, जो उसकी इनर्वेशन है, वो दोनों वो सब चीज़ें जो है वो डिफरेंट हैं. नर्व सप्लाई, उसकी एक्शंस और उनके अटैचमेंट्स तीनों डिफरेंट हैं, इसीलिए इसको हम कंपोजिट और हाइब्रिड मसल कहते हैं. जो एडक्टर पार्ट है, इट बेसिकली इट अराइजेज फ्रॉम द इंफीरियर रेमस ऑफ द प्यूबिस, रेमस ऑफ इस्चियम, यानी कि इस्चियो प्यूबिक रेमस ऑफ द प्यूबिस से अराइज करता है. जबकि जो हैमस्ट्रिंग पार्ट है, ठीक है, इट अराइजेज फ्रॉम द इस्चियल ट्यूबरोसिटी. Now the adductor part, it is inserted into the gluteal tuberosity here, and the linea aspera along the length of the shaft of the femur and the medial supracondylar line. ठीक है, here it is attached the adductor part of this you can see adductor part of the magnus. The hamstring part is attached to the adductor tubercle of the femur. Here you can see this is a adductor tubercle present on the condyle of the lower end of the femur, and it gives attachment to the hamstring part of the adductor magnus. Now within the lower end of this muscle of the adductor magnus, you can see a hole or aperture is present here. This is basically that is an opening or aperture between the aponeurotic distal attachment of the adductor part of the adductor magnus and the tendinous distal attachment of the hamstring part. This is known as the adductor hiatus. It basically permits the femoral vessels, as you can see, the femoral artery and femoral vein to pass from the adductor canal down into the popliteal fossa. Now the adductor part of the adductor magnus is supplied by the is innervated by the obturator nerve, that is the L2, L3, L4, that is branches of the posterior division, whereas the hamstring part is supplied by the tibial part of the sciatic nerve. The action of this adductor magnus is that it adducts the thigh, whereas the alone, if we talk about the separately of the two parts, the adductor part it flexes the thigh, whereas the hamstring part it extends the thigh. Now the second muscle is the adductor brevis muscle. Adductor brevis muscle is basically a short muscle which lies deep to the pectineus and the adductor longus muscle. The importance of this muscle is that it is easy to recognize this muscle during dissection, because the obturator nerve, when it enters from the gluteal region into the medial compartment of the thigh, it divides into anterior and posterior division, and these anterior posterior divisions they pass anterior and posterior to this adductor brevis muscle, which makes the recognition of this muscle easily. Now talking about the attachment of the adductor brevis, it arises from the body and the inferior ramus of the pubis, whereas it is inserted into the pectineal line and proximal part of the linea aspera of the femur. As you can see, this muscle, and this is the adductor brevis muscle arising from the body and inferior ramus of the pubis and inserting into the pectineal line and the proximal part of the linea aspera of femur. Now this adductor brevis is supplied by the obturator nerve L2, L3, L4, which is a branch of the anterior division, and it adducts the thigh. To some extent it also flexes the thigh. The adductor longus, the other muscle of the adductor compartment, it is large fan-shaped muscles, and it is the most anteriorly we can say the most superficially placed muscle of the adductor group. Now this adductor longus muscle, it arises from the body of the pubis and the just inferior to the pubic crest. This is pubic symphysis, this is pubic crest, and just inferior to the pubic crest there is origin of this tendon of the adductor longus. Then this muscle fan out and to be inserted along the middle third of the linea aspera of the femur. So you can say this is a fan shaped or triangular muscle with the base attached to the linea aspera and the apex attached to the body of the pubis. The adductor longus is supplied by the obturator nerve, again by L2, L3, L4, and the action of this muscle is that it adducts the thigh. Now comes the gracilis. Gracilis, as you can see, it is a long strap-like muscle and is most medially placed, medial most muscle of the medial compartment of the thigh. It is the superficial of the adductor group and the weakest member of the adductor family. It arises from the body and the inferior ramus of the pubis, and it is inserted into the superior part of the medial surface of the tibia. Gracilis is supplied by the obturator nerve L2, L3 division, and the function of the action of the gracilis that it adducts the thigh, flexes the legs, and helps to rotate it medially. Now obturator externus, it is which is also a member of the medial compartment of the thigh. It is flat, relatively small fan-shaped muscle that is deeply placed in the supromedial part of the thigh, arising from the margins of this obturator membrane and inserting into the trochanteric fossa of the femur. The obturator externus is innervated by the obturator nerve, and it basically rotates the thigh laterally and steadies the head of femur in the acetabulum. Now this table shows the summary of the muscles of the medial compartment. The gracilis, we have said this is the medial most and the longest muscle of the medial compartment, arising from the inferior ramus of the pubis and ramus of ischium and inserting into the upper part of the shaft of the tibia on the medial surface, innervated by the obturator nerve. Then we have the adductor longus, the fan-shaped triangular muscle with the apex arising from body of pubis and medial to the pubic tubercle, whereas the base inserting into the linea aspera of the femur, innervated by the obturator nerve. The adductor brevis, shortest muscle arising from the inferior ramus of pubis and inserting into the posterior surface of shaft of femur, that is on the linea aspera, and innervated by the obturator nerve. Then we have the largest, strongest muscle, the adductor magnus, comprising of two parts arising from inferior ramus of pubis, ramus of ischium and ischiotuberosity, and inserting into the posterior surface of shaft of femur and adductor tubercle of the femur. The adductor part innervated by the obturator nerve, whereas the hamstring part innervated by the sciatic nerve. Then we have the obturator externus arising from the surface or the margin of the obturator membrane and inserting into the medial surface of the greater trochanter, innervated by the obturator nerve. So these are the muscles you can see of the medial compartment: the adductor magnus, the hole in the lower part of the distal attachment, that is the adductor hiatus, through which the femoral artery and femoral vein they passes from the adductor compartment to the popliteal fossa. Then we have the adductor brevis. Adductor brevis, we have said that it is one of the recognizable point is that the anterior and the posterior division of the obturator nerve, they pass anterior and posterior to this muscle, that is the adductor brevis muscle. Then we have the adductor longus muscle, which has been cut from here, and this is the now we will discuss the blood supply of the medial compartment. The main blood supply to the medial compartment is provided by the profunda femoris artery, which is basically a branch of the femoral artery. Now this large artery arises from the lateral side of the femoral artery. This one you can see arising from the lateral side of the femoral artery in the femoral triangle, about 1.5 centimeter, 5 inches below the inguinal ligament, and then it descends between the adductor longus muscle here and the adductor brevis muscle. This you can see, this is the profunda femoris artery. Now this profunda femoris artery, it basically gives gives three branches. We have the medial femoral circumflex artery, the lateral femoral circumflex artery, and also it gives four perforating arteries. These are the perforating arteries, and this profunda femoris artery, it ends as a fourth perforating artery. The three perforating arteries are given along its way, and then all these arteries, they run in the substance of the adductor magnus muscle, and it terminates, the profunda femoris artery terminates as the fourth perforating artery. The other branches of the profunda femoris, as we have discussed, are the medial femoral circumflex artery. The medial femoral circumflex femoral artery, it passes this one, it passes medially and posteriorly between the pectineus and iliopsoas muscles and enter the gluteal region and give rise to the various posterior retinacular arteries, and then terminates by dividing into transverse and an ascending branch. This is the ascending branch and this is the transverse branch. Now this medial femoral circumflex artery also takes part in the formation of the cruciate anastomosis and gives off various muscular branches to the muscles. Now the other branch of the profunda femoris is the lateral circumflex femoral artery, which passes laterally deep to the sartorius rectus femoris, dividing into the ascending, transverse and descending arteries. These lateral circumflex artery, it basically takes part in the formation of the cruciate anastomosis. Now the profunda femoris artery also gives perforating arteries. Three perforating arteries, they are given along the course, which winds around the posterior aspect of the femur, and it terminates as the fourth perforating artery. Now these perforating arteries, they anastomose with another, and also with the branches of the inferior gluteal artery, branches of the circumflex femoral arteries, and also anastomose with the branches of the popliteal artery. The profunda femoris vein, it receives the tributaries, and that corresponds to the branches of the artery, and then drains into the femoral vein. Now we can see the arteries supplying the medial compartment. The profunda femoris, it is also known as the deep artery of the thigh, giving the lateral circumflex femoral artery and the medial circumflex femoral artery. The medial circumflex femoral artery, in turn, it gives two branches, that is the transverse and ascending branch, whereas the lateral gives three branches, that is the ascending, transverse and a descending branch. In addition, it also gives the perforating branches, three perforating branches, which winds around the posterior aspect of the femur and is moves with each other, and this profunda femoris artery terminates at the fourth perforating artery. The other important artery supplying the adductor compartment is the obturator artery. Obturator artery is basically a branch of the internal iliac artery, and in about 20% of cases it arises as an accessory or replaced artery from the inferior epigastric artery. Now this obturator artery, it passes through the obturator foramen, enters the medial compartment and divides into anterior and posterior branches, which passes on the respective sides of the adductor brevis. Just like we have discussed कि जो obturator nerve है वो भी adductor brevis ही के substance के ऊपर के mass के ऊपर anterior posterior division में divide हो जाती है. उसी तरह से जो obturator artery है वो भी anterior posterior ब्रांचेस में डिवाइड होती है, एडक्टर ब्रेविस की इंटीरियरली और पोस्टीरियरली उसको फॉलो करती हैं. जो इंटीरियर ब्रांच है वो सप्लाई करेगी ऑब्चुरेटर एक्सटर्नस मसल को, पेक्टिनियस को, एडक्टर्स ऑफ थाई को और ग्रेसलस को, जबकि जो पोस्टीरियर ब्रांच है वो सप्लाई करती है मसल्स विच आर अटैच्ड टू द ischial tuberosity. लाइकवाइज दी obturator vein जो है वो रिसीव करेगी ट्रिब्यूटरीज दैट कॉरेस्पॉन्ड्स टू द ब्रांचेज ऑफ द आर्टरी, एंड देन इट विल ड्रेन इनटू द इंटरनल आइलियक वेन. Now the innervation to the medial compartment or the adductor compartment is provided by the obturator nerve, which is basically arising from the lumbar plexus L2, 3, L4 and emerges on the medial border of the psoas muscle within the abdomen. It runs forward on the lateral wall of the pelvis to reach the upper part of the obturator foramen. Now as this obturator nerve, it emerges from the obturator canal to enter the medial compartment of the thigh. It splits into an anterior and the posterior division. Okay, and the two divisions, as you can see, they passing on the anterior and posterior aspect of the adductor brevis. Now the anterior division, it will supply the gracilis muscle, okay, the adductor brevis muscle, adductor longus muscle, and occasionally it also supplies to the pectineus, give a branch to the femoral artery, branch to the hip joint, subsartorial plexus of the skin and on the medial side of the thigh. Whereas the posterior division, it supplies the obturator externus and articular branch to the knee joint and adductor part of the adductor magnus muscle, and also it gives a branch to the adductor brevis. So you can see here, this is the obturator nerve, okay, dividing into the anterior division, this one, and into the posterior division, this one. And this is a summary of the area supplied by the obturator nerve, emerging from the lumbar plexus L2, 3, 4 in the abdomen, enters the pelvis and then divides into the anterior and posterior divisions. Anterior division supplying the hip joint, the longus muscle, adductor brevis, gracilis, subsartorial plexus, and also it gives a branch to the femoral artery, whereas the posterior division supplying the adductor magnus, the adductor portion, okay, adductor brevis, also a branch to the knee joint, articular branch, and also two branches to the popliteal artery. Now we will discuss some conditions related to the muscles. The gracilis, we have said, it is the most medial most placed muscle of the adductor group, and it is also a weak member of the adductor group. इसी वजह से हमको the surgeon, it can be easily use this muscle for transplant, ठीक है, and the surgeon basically take a part of the this muscle along with their nerve and blood vessels to replace a damaged muscle in the hand, for example. Then नाउ बेसिकली जो एडक्टर मसल्स हैं दैट इज जो कि एडक्टर लॉन्गस, एडक्टर ब्रेविस, एडक्टर मैग्नस, इनका मेन फंक्शन क्या है कि दे एडक्ट द थाई, दैट इज मूव द थाई मीडियली टुवर्ड्स द मीडियन प्लेन। और जितनी भी मूवमेंट्स होंगी जिसमें थाई जो है मीडियली रोटेट हो, उन सब में ये हेल्प करता है। वन ऑफ द एग्जांपल इज़ दैट जो हॉर्स बैक राइडर्स होते हैं, ठीक है, दे यूज टू एडक्ट देयर थाइज टू प्रिवेंट देम फ्रॉम फॉलिंग डाउन। और कंटिन्यूस एडक्शन की वजह से, फ्रिक्शन की वजह से क्या होगा कि ऑसिफिकेशन हो जाती होती है, समटाइम्स अकर्स इन द टेंडन ऑफ दीज मसल्स, ठीक है, बिकॉज ऑफ द टू मच एडक्टिंग देयर थाइज टू कीप देम फ्रॉम फॉलिंग फ्रॉम द हॉर्स। और ये जो ऑसिफाइड टेंडेंस हैं दे समटाइम्स रॉन्गली आर कॉल्ड एज दी राइडर्स बोन। इस तरह से थिकन हो जाता है और बिल्कुल बोन की तरह अपीयर होता है, इसको हम कहते हैं राइडर्स बोन। द पेशेंट्स ऑफ सेरेब्रल पाल्सी, उनमें क्या होता है कि जो एडक्टर मसल्स हैं दे बिकम्स रिजिड, हार्ड हो जाती हैं। और इस रिजिडिटी की जो है को रिमूव करने के लिए समटाइम्स जो ऑब्चुरेटर नर्व है उसकी इंटीरियर डिवीजन को डिवाइड करना पड़ता है, ठीक है। टेंडन ऑफ दी एडक्टर मसल्स को जो है वो थोड़ा सा कट करके जो है वो इंटीरियर डिवीजन ऑफ ऑब्चुरेटर नर्व को डिवाइड करते हैं, जिसकी वजह से जो है वो मसल्स, एडक्टर मसल्स स्पेशली जो है वो रिलैक्स हो जाते हैं। Now we will move to the posterior compartment of the thigh. Posterior compartment को भी हम उसी sequence के through discuss करेंगे. Initially the cutaneous nerves, it is supplied by the branches of the posterior cutaneous nerve of the thigh, which is basically a branch of the sacral plexus. Then we have the superficial veins. Many veins they curve around the medial and lateral aspects of the thigh, and ultimately they will drain into the great saphenous vein. And the lymph vessels and lymph from the skin and superficial fascia on the back of the thigh, it will drain upwards and forward into the vertical group of the superficial inguinal lymph nodes. Now discussing the contents of the posterior compartment of thigh, we have muscles. Now these muscles of the posterior compartment, they are known as the hamstring muscles, which include the biceps femoris, semitendinosus, semimembranosus, and a small part of the adductor magnus. The blood supply, which is basically through the branches of the profunda femoris artery, and nerve supply is through the sciatic nerve. Now we have said that जो posterior compartment के मसल, इनको hamstring muscles कहा जाता है। hamstring क्यों कहते हैं? Because it is common to tie hams, यानी कि जो poke thighs हैं, up for curing, for drying and for smoking using the long tendons of these muscles. इन muscles के tendons जो हैं वो बहुत long होते हैं, इस वजह से इनको यूज़ करते हैं for hanging purpose. मीट को ड्राई करना है, स्मोक देनी है, क्योर करना है। Now the muscles जो इसमें है, उसमें सबसे पहले हम सेमीटेंडिनोसिस मसल है। The सेमीटेंडिनोसिस मसल, this one as the name indicates is semitendinous. इसका एक long tendon होता है, ठीक है। It has a fusiform type belly है, that is usually interrupted by a tendinous intersection and a long cord-like tendon. This one origin जो है वो इसका आएगा from the ischial tuberosity and it is inserted on the medial surface of the superior part of the tibia. Now this muscle is innervated by the tibial division of the sciatic nerve L5, S1 and S2. The action of this muscle is that it extends the thigh, flex the leg and rotate it medially when knee is flexed, when the knee is flexed, and when thigh and the legs are flexed, these muscles can extend the trunk. I will discuss the combined action of these hamstring muscles at the end of the muscle section. One another important point is that कि जो सेमीटेंडिनोसिस का जो टेंडन है, ठीक है, व्हेन इट इज़ इंसर्टिंग ऑन दी साइड ऑफ दी टिबिया, ठीक है, इट इज़ कंबाइंड विद द टेंडन ऑफ द सार्टोरियस coming from the anterior compartment and tendon of the gracilis which is coming from the medial compartment. All the three muscles, that is gracilis, sartorius and the semitendinosus, they combinedly form a pes anserine, and this their insertion is through this pes anserine on the medial side of the upper part of the tibia. Now the semimembranosus, it is a broad muscle that is also aptly named because of the flattened membranous form of its proximal attachment to the ischial tuberosity. Origin है वही again ischial tuberosity and insertion into the posterior part of the medial condyle of the टिबिया रिफ्लेक्टेड, इसका एक थोड़ा सा पार्ट जो है इसका टेंडन का, जहाँ पर ये सेमी मेम्ब्रेनोसस में अटैच होता है ऑन द पोस्टीरियर पार्ट ऑफ द मीडियल कोनाइड ऑफ टिबिया, वहाँ से रिफ्लेक्ट करता है पार्ट ऑफ दिस एंड इट फॉर्म्स द ओब्लिक पोप्लिटियर लिगामेंट टू दी लेटरल, और वहाँ से आता है टू दी लेटरल कोंडाइल ऑफ द फीमर. This is the oblique popliteal ligament, which is a reflected part of the semimembranosus muscle. Now, the semimembranosus muscle is again supplied by the tibial division of the sciatic nerve, and then we have the bicep femoris, a large muscle comprising of two heads. Fusiform muscle है जिसके दो parts हैं, a long head and a short head. In the inferior part of the thigh, the long head becomes tendinous and it is joined by the short head. यानी कि almost in the lower part में दोनों जो heads हैं वो join कर जाते हैं. अब origin कहाँ से होता है इसका, कि जो long head है it arises from the ischial tuberosity. ये आपने एक बात नोट की होगी कि तीनों जो muscles हमने posterior compartment के डिस्कस किए हैं, इन तीनों का जो origin है वो सेम है, that is from the ischial tuberosity. यानी semitendinosus भी वहीं से आ रहा है, semimembranosus भी, और जो biceps का जो long head है it is also arising from the ischial tuberosity. whereas जो short head है इसका ये आता है from the linea aspera and the lateral supracondylar line of the femur. अब ये इंसर्ट कहाँ पर करेंगे, ये इंसर्ट करते हैं दोनों जो मसल्स हैं यूनाइट करके, जो टेंडन है इनका, दे आर इंसर्टिंग इनटू द लेटरल साइड ऑफ द हेड ऑफ द फिबुला. टेंडन इज स्प्लिट एट दिस साइड बाय द फिबुलर कोलैटरल लिगामेंट ऑफ द नी जॉइंट. The long head is supplied by the tibial division of the sciatic nerve, whereas the short head is supplied by the common fibular division of the sciatic nerve L5, S1 and S2. Now, as far as the action of these hamstring group of muscles is concerned, इसमें जो तीन मसल्स हैं दैट इज़ सेमीटेंडिनोसिस, सेमीमेम्ब्रेनोसिस और बाइसेप्स का जो लॉन्ग हेड है, ठीक है, ये इनमें कुछ फैक्टर्स कॉमन हैं. वो क्या है, एक तो हमने ऑलरेडी डिस्कस किया कि इनका जो ओरिजिन है वो ischial tuberosity से आता है, ठीक है, और इनकी जो इंसर्शन है, डिस्टल अटैचमेंट है, वो बोन ऑफ द लेग पे होती है. अच्छा, अदर इसका मतलब है कि ये जो हैं वो दो जॉइंट्स पे एक्ट कर रहे हैं, एक्सटेंशन करते हैं हिप जॉइंट पे और फ्लेक्शन करेंगे ये नी जॉइंट पे. और इसके अलावा एक और जो फैक्टर इन तीनों मसल्स में कॉमन है, इट इज़ दैट दे आर इनर्वेटेड बाय द टिबियल डिवीजन ऑफ द sciatic nerve. लेकिन जो दोनों इसके फंक्शन हैं दैट इज़ फ्लेक्शन ऑफ द नी जॉइंट एंड एक्सटेंशन ऑफ द हिप जॉइंट, ये साइमल्टेनियसली नहीं हो सकते. क्यों? बिकॉज फुल फ्लेक्शन ऑफ नी के लिए मसल जो है वो शॉर्टन होता है, ठीक है, सो मच शॉर्टनिंग ऑफ द हैमस्ट्रिंग होती है कि दे कैन नॉट प्रोवाइड एडिशनल कंट्रैक्शन दैट वुड बी नेसेसरी फॉर द साइमल्टेनियस फुल एक्सटेंशन ऑफ द थाई. इस तरह से जो फुल एक्सटेंशन ऑफ द हिप है इट शॉर्टन्स द हैमस्ट्रिंग सो दैट दे कैन नॉट फर्दर कॉन्ट्रैक्ट टू एक्ट फुली ऑन द नी. लेकिन जब थाइज एंड लेग्स दे आर फिक्स्ड होते हैं, हैमस्ट्रिंग कैन हेल्प एक्सटेंड द ट्रंक एट द हिप जॉइंट. Now these hamstring muscles, they are supplied by the four perforating branches of the profunda femoris artery, which provides a rich supply to the compartment. Now the four branches of profunda femoris, we have discussed that the profunda femoris, after arising from the femoral artery, it gives three branches, perforating branches throughout along its course, which basically runs in the substance of the erector magnus, and it terminates as the four perforating arteries. And these perforating arteries, they anastomose with one another and also with the branches of the circumflex femoral arteries, branches of the inferior gluteal artery and branches of the popliteal artery. The profunda femoris vein drains the greater part of the blood from the compartment. Now the innervation of the posterior compartment is provided by the important sciatic nerve. The sciatic nerve branch of the sacral plexus L4, 5, S1, S2 and S3. It is a large nerve which enters the gluteal region by passing through the greater sciatic foramen inferior to the piriformis muscle and deep to the gluteus maximus muscle, descends in the posterior thigh deep to the biceps femoris and the bifurcates into the tibial and the common peroneal nerves at the apex of the popliteal fossa. The tibial part it is the medial nerve, and the common peroneal part is the lateral component of the sciatic nerve. So we have two branches of the sciatic nerve, the tibial nerve and the common peroneal nerve, and also it gives the muscular branches to supply the muscles in the gluteal region, supplies all muscles of the posterior compartment of the thigh. इसमें से भी tibial division जो सप्लाई करती है सारे muscles को except the short head of the biceps, जो हमने कहा था कि it's supplied by the common fibular division or the common peroneal division. Basically जो common peroneal nerve है ये वाइंड्स अराउंड करती है और इट इज़ रिलेटेड टू दी नेक ऑफ द फिबुला. इसी वजह से इसको जो है वो इसका जो नाम है वो हम इसको कॉमन फिबुलर नर्व कहते हैं इंस्टेड ऑफ द कॉमन पेरोनियल नर्व. नाउ अगर इसी सciatic नर्व की कंप्रेशन हो जाए क्या अगेंस्ट दी फीमर, या फिर बहुत देर बैठे रहने के बाद जब हम बहुत देर बैठे रहें किसी हार्ड सरफेस के ऊपर, लाइक जब स्टूडेंट्स बैठ जाते हैं बेंचेस के ऊपर, तो उसकी वजह से क्या होगा, देयर इज़ कंप्रेशन ऑफ द sciatic नर्व एंड एक कंडीशन होती है जिसको हम कहते हैं स्लीपिंग फुट, यानी कि पाँव जो है बिल्कुल सुन हो जाता है, बिल्कुल जिस तरह सोया हुआ होता है बिल्कुल, दैट इज़ नोन एज द स्लीपिंग फुट. नाउ अनदर इम्पॉर्टेंट कंडीशन विच बहुत कॉमनली आप लोग ने सुनी होगी नोन एज द sciatica. Sciatica बेसिकली क्या होता है, इट इज़ अ शूटिंग पेन अलॉन्ग द cutaneous डिस्ट्रीब्यूशन ऑफ द sciatic nerve, और उसकी जो टर्मिनल ब्रांचेस होती हैं. एंड बेसिकली पेन कहाँ बिगिन करती है, इन द ग्लूटियल रीजन, और रेडिएट करती है अलॉन्ग दी बैक ऑफ द थाई एंड द लेटरल साइड ऑफ द लेग टू द डोर्सम ऑफ द फुट. इसका कॉज क्या है, इट कैन बी ड्यू टू कंप्रेशन एंड इरिटेशन ऑफ वन और मोर नर्व रूट्स फॉर्मिंग द sciatic nerve. जितने भी नर्व रूट्स हैं जो sciatic nerve बनाते हैं उनकी कोई कंप्रेशन है, किसी वजह से कोई इरिटेशन है, कोई भी पैथोलॉजिकल फैक्टर इन्वॉल्व हो सकता है, तो उसकी वजह से जो है देयर इज़ दिस शूटिंग पेन अलॉन्ग द cutaneous distribution of the sciatic nerve. I hope you have understood the medial and the posterior compartments. Thank you.